Good morning, everybody. Welcome to our webinar on the COVID-19 vaccination program compliance. We will give our colleagues a few moments to join us, and we'll get started shortly. Good morning, everybody. Thank you so much for joining us this morning. We are going to be covering Supervisor's Guide to the COVID-19 Vaccination Program Compliance. My name is Pamela James, and I am joined by three fellow HR experts who I will now ask to go ahead and introduce themselves. First, Dale.
Good morning, I'm Dale Cole. I'm the Director of HR Client Services for UCI Health.
Thanks, Dale. Jeff.
Hey, good morning, everyone. Excited to be here. My name is Jeff Hughes. I'm Workforce Relations Consultant supporting campus.
Thank you, Jeff. And Julie.
Hi, good morning. I am Julie Lance. I serve as an HR business partner for campus clients. Good morning.
Great. Thank you, Julie. Well, let's go ahead and take a look at our agenda today. We're covering a lot of topics. First, some of the considerations that we as leaders have as we prepare to return to work on site, so a little bit of context. We'll spend a lot of time on the details of the vaccination program. And then importantly, our role as supervisors in the program. Next, we will spend time on how to respond to common employee questions. We've collected about a dozen or so scenarios that we've already been asked about, and we'll share suggested responses with you. Finally, we'll highlight some resources that all leaders have access to. We'll take time at the end to answer any additional questions. Since this is a webinar format, the chat functionality is inactive. However, you can use the Q&A box at the bottom of your Zoom screen to submit questions. And we'll have time at the end of all of our content to address those questions later. We are sharing a lot of content today. Therefore, we are recording this session, and a PDF of this presentation, which has a lot of live links for easy access to all the websites, and a link to the recording of this will be available on the Future of Work website. In fact, you'll see in the chat box that location, which you might want to bookmark. In fact, a PDF of this presentation has already been loaded this morning, so you'll have easy access to it very soon. So let's first talk about the many considerations that we leaders have on our plate when planning for a return to on-site work during COVID-19. Leaders have a lot of balls in the air right now as you transition your workforce back to on-site or hybrid work. On the upper left, you see the logistics of returning on-site that we're all doing. Those include steps such as determining which positions are eligible or not eligible for remote work, completing remote work agreements with employees, determining schedules, especially for hybrid staff, and also possibly making any adjustments to workspace. On the upper right, from a safety perspective, you're ensuring that staff have taken the COVID safety training. Remember that came out over a year ago, and we all have to do it. So you can check on that. Also, that we're all continuing to do the daily symptom check. That's also a requirement. And finally, using any non-pharmaceutical interventions, such as masks, that are now required for everybody indoors. Today, we'll focus mainly on the two bottom areas on the screen. First, the policy details and how to ensure compliance. And then finally, how leaders can best support our employees. So first, the basics of the COVID vaccination program. All employees must provide proof of vaccine or submit an exception request by the effective date of the policy. Effective dates vary, but most are in early September, as you can see. September 1st for health, September 6th for campus. We do have a few schools that had earlier start dates, such as the School of Medicine and the School of Law. And then new hires after September 6th will have 8 weeks from the start date of the effectiveness of the policy to be compliant. And all the links on this deck are live, so there's a link here to the actual full policy. And you can see on the bottom left who this policy covers. Basically, a lot of categories of employees and students who physically access UCI in connection with their employment, appointment, or education and training. And on the lower right, you can see who is not covered by this policy. UCI must track and monitor vaccination verifications and exception requests. We have a self-service process to upload those vaccination records, and hopefully most of you have already uploaded your documentation. These records are uploaded to a secure website and are considered private health information, and they're only accessed by authorized public health individuals. So supervisors do not see this private documentation. You'll see here that campus employees have a separate verification process from UCI Health. There's 2 different links there. And then at the bottom, students also have a separate verification process. Here are the 4 types of vaccination exception requests. And these are reviewed by a third-party authorized vendor, Sedgwick. What happens if an exception request is approved? Well, then the employee is considered in compliance with the vaccination program. However, those with exceptions are required to not only mask, which all of us are required to do, but also when on site, they have to complete weekly asymptomatic testing. Now, if someone's request is denied, then the employee is notified of that denial and must provide proof that they've received their first vaccination within 14 calendar days of that date of denial. And we'll talk more about additional steps of compliance shortly. Here are the instructions to download the exception request form, get the proper signatures, and then upload it to the right website. Note that for medical exemptions and disability exception requests, employees must also have their healthcare provider complete and sign the document. This is also a very easy self-service website. As a reminder, supervisors should never accept or receive any vaccine documentation directly from employees. You should refer them to the upload self-service options. Now, as supervisors, we all have an important role in compliance, in the compliance process. So let's talk about that. Here's what I call a wagon wheel graphic to see how important your role as a leader is. Going clockwise, starting in the upper right, we're busy planning for employee returns, and that means a lot of communications. Then we begin bringing people back on site. That might be already happening over the course of the summer. And then it's important to monitor how it's going, how employees are feeling, and adjust plans as needed. So let's delve a little deeper into each of these areas a bit more. As I said, we've all been doing lots of planning for the return, so let's focus on the communications. It is always good to err on the side of too much communication, especially in anxious times of major transitions like this. Remember, this vaccination program is new, so it's really important to discuss it in staff meetings, in one-on-ones, to emphasize the requirements. Don't expect that employees necessarily fully understand what's expected. We know that the safest precaution against COVID-19 is vaccination. So we want you to encourage all employees to get vaccinated and to upload their documentation. And if employees express any concerns about the safety of the vaccine, refer them to the experts in public health. We do not expect you to be medical or public health experts. We just expect you to encourage employees to be compliant with the policy. So moving around this wheel, you have employees starting to come back on site. We will have a vaccination policy dashboard available that tracks compliance, and we'll share details on that dashboard in a few slides. Supervisors are responsible for ensuring that employees are doing their daily symptom check and complying with the vaccination policy, which for now means all employees must wear a mask and some employees must also be tested weekly. And you'll know who is in that category. And HR can always assist you with the steps regarding non-compliance, and we're going to cover that more in a bit as well. So now we're at the center of the wheel. Remember that employees have been through a lot in the last 18 months. We all have. Anxiety and stress are high, and returning on site can be challenging, not just logistically, but emotionally for many. So leaders really need to be in a supportive role and practice active listening and empathy, because not everybody handles change the same way. Not everybody reacts the same. So we need to set aside any biases that we have and really just actively listen to our staff and offer alternatives and some flexibility, especially when we have to deny a request. Try to provide alternatives. You might not be able to give the staff exactly what they want, but offering alternatives and listening and providing support is very helpful. Remember, this fall is an experiment. We need to be willing to see how it's going and adapt to the business needs and also our employee needs. The final point here is to encourage employees to focus on what they can control. UCI is practicing all of the recommended safety protocols, and employees can practice them as well. One caution in your communications with employees, an important clarification. We cannot ask an employee if they've been vaccinated. This is a violation of health information privacy. What you can do is encourage employees to be compliant with the policy, and that they can do that by either getting a vaccination or submitting an exception request. Next slide, please. Thank you. UCI is using a dashboard to monitor vaccination policy compliance. Now, senior leaders and HR already have access to this dashboard, and some schools or units may designate a central resource to handle compliance completely. So check with your senior leadership or your local HR. On this dashboard, basically a color-coded dashboard, and you'll see a sample in a moment. Green means that the employee is cleared to be on site. And right now, even cleared to be on site means we all wear a mask. I'll be saying that more times. Yellow means that the employee is cleared to be on site or pending an exception. That means they may be cleared to be on site because they have an approved exception. And they must not only wear a mask, but they also must comply with the weekly asymptomatic testing. Red means that the employee is not cleared yet, and they should be reminded to submit verification or an exception request as soon as possible. If they do not, beyond effective date, they could be subject to corrective action, and we'll talk about that in a bit. As supervisors, you may have access to information about whether each of your employees is cleared or not cleared to be on site. However, you should not share that information with anyone else. You just talk to that direct employee about their status and nobody else on the team. Next slide. So here's a snapshot of the compliance dashboard. I know you can't really read anything on this, but it's just a visual. There's a pie chart of the percentages of number of employees in your unit in green versus red versus yellow. And this is for tracking purposes to follow up with anyone who's not in compliance. And as I said, while supervisors may be aware of whether someone's cleared with NPI, which are non-pharmaceutical interventions such as masking and testing, or not cleared, it is not appropriate to share that status with others, nobody else, only the actual employee. All right, so we've been talking about non-compliance. What does non-compliance look like? Four basic categories. First, there are those who fail to provide the proof of a full vaccination, those who have not requested an exception or deferral by the implementation date, employees who might be denied that, who are denied that exception and then fail to provide proof of vaccination. And then finally, those who aren't following our NPI protocols, such as not wearing a mask and not getting their weekly testing. What do we do about non-compliance? Here's a brief overview of what the process is when you have employees who are not in compliance. First, in green, which is before the effective date of the policy, your job as a leader right now is to educate employees on the policy, the process, and the resources, and to encourage compliance. Once the policy is effective, To ensure a fair and consistent process, we have developed standard notices of noncompliance letters and a timeline. Central HR will manage this process. So in the yellow, orange, and red phases on this slide, there will be automated notices sent to employees and their supervisors. So you will be in the loop on when you have an employee who is receiving these noncompliance notices. If your employee gets into the red area, receives a notice of continued noncompliance, and still does not comply, the next step will be to initiate corrective action in partnership with HR. You'd never do this on your own. And of course, any corrective action we do will be consistent with applicable policies or collective bargaining provisions. Also, enforcement for represented employees is pending effects bargaining right now. Consult with HR every step of the way. My closing advice on this slide is that the more effort you put into the green phase right now before the policy is effective, then the fewer non-compliance follow-ups we'll have later. Okay, that's it for a review of the policy. I'd love to turn it over now to my colleague, Dale Cole.
Thank you, Pamela. Let's discuss some commonly asked questions that we've received from employees and provide you as leaders with some ways to respond to those. Next slide, please. So these are some of the most commonly asked questions that we've received from leaders relative to the COVID policy and returning employees to work. My colleagues, Julie and Jeff, and I will provide you with real-life scenarios and share our thoughts on how to respond to each of these scenarios. So let's start with a scenario in which an employee has a fear of exposure when they return to on-site work. Your employee does not want to return to on-site work because they are concerned about contracting COVID-19. Their job requires them to be on-site. You need them to come back. So what are some ways that you might handle this situation? Can you require them to return? And what happens if they refuse? It's important to remember that we will make decisions about which employees need to return to on-site work based on operational needs, not on the individual needs of employees. So let's operate first from the perspective that you, as the leader, have done a good job of evaluating that the employee must return to on-site work in order to meet the operational needs of the department. Fear of exposure is a real and valid concern for many employees. We all want to protect our health. This is true both at work and in the community at large. And with a variety of different messages in the public domain, it's often hard to know how to do this in the best way. So start with engaging the employees about their fears. Seek to understand what they know about the various safety precautions and how to utilize those precautions in the workplace. Engaging them in a conversation about how they protect themselves in public at places like restaurants, get-togethers, grocery stores, etc., may help to guide the employee in using those same protocols at work. Remind the employee of the safety precautions that they can take at work. Some basic safety precautions are things like wearing masks, maintaining social distancing, eating outside and away from others, and cleaning surfaces regularly. Also remind them of the safety precautions that all employees are required to comply with when they're on campus, such as masking, daily symptom checking, and where required, the weekly asymptomatic testing. Help the employee to take control of the things that are within their control and to focus on doing those things first and foremost. You can also refer the employee to UC subject matter experts for current and accurate information about COVID-19, vaccinations, and how to stay safe in settings where you don't know everyone's vaccination status. Now I'm going to have my colleague Julie present the next scenario. Julie?
Thanks, Dale. So just like your employee, that was worried about their own exposure, this employee is worried about putting their unvaccinated child in daycare and their exposure. So they want to continue working from home. However, their normal job duties require them to be on site. So as a supervisor, what do you do? Is this a valid reason for an employee not to return? How would you respond to this scenario? So as we know, fears surrounding family members who are not vaccinated is not a basis to continue working remotely. But this is an opportunity for you as a supervisor to show empathy, connect with your employee, and support them. While you can't necessarily grant them to continue working remotely, you can talk through different options, share the resources, and offer them support. This is a tough time for us as supervisors and also our employees. So it's important that we offer that support. With a caution though, we don't want to impose our values or views saying, oh, we have children of the same age. I put Tommy over here, so you should do the same thing. Each individual is going to approach this with their own values and their own level of comfort. So we need to support employees. At the same time, work on getting our jobs done. Okay, next slide. And now I'll turn it over to Jeff.
All right, thanks, Julie. So we have another fear of exposure scenario here. So this time you're asked by your employee the vaccination status, or at least the cleared, not cleared status of their coworkers. Is it appropriate for you to share vaccination status of your employees with other employees? And then what about the cleared, not cleared status? Is that appropriate to share? The primary answer, as Pamela explained earlier, is that at no time should employee vaccination status be shared with other employees. Vaccination status is medical information, and it's a violation of privacy laws to share private health information with others. We really want this to be a clear takeaway from this training. That's why Pamela talked about it earlier, and you'll probably hear me talk about it a couple times here. It's also not appropriate to share cleared or not cleared status. Ultimately, as a supervisor, it's your role to monitor compliance for your team. You have access to this information, and you're really the only one that needs access to this information to monitor and ensure compliance. Now, to the extent employees have concerns about not complying or about others not complying, they can certainly raise those concerns to you as a supervisor, but the message to them should really be to concentrate on their own actions and not those of their colleagues. Dale will take us through the next slide.
Thank you, Jeff. We're going to stay with our theme of fear of exposure. And here in this scenario, we have an employee who presents a doctor's note that requires them to work remotely. However, their position requires them to be on site. So the questions you may be asking yourselves are, if they are required to work on site, can you still require them to come on site with the doctor's note? And what's your next step? So ideally, an employee would not be providing a leader with a doctor's note. Doctor's notes often contain private and confidential information, which we do not want the leader to be privy to. So instead of accepting the doctor's note from the employee, ask them to contact the EEC to provide the doctor's note and initiate a case. Once the EEC has initiated the case, it will be assigned to HR's Disability Management Unit. The Disability Return to Work consultant will review the medical documentation and contact the department to discuss the accommodation request. As with any accommodation request, UCI will have to meet and discuss with the employee and department whether or not there's a reasonable accommodation that can be provided. The disability consultant will partner with the department on the issue. The department should not attempt to respond to the medical documentation on their own. And now I'll turn it back to Julie for another scenario.
Thanks, Dale. So you know that your employee is not vaccinated. They've shared this with you. And now this one's about yourself. You're concerned about your own exposure, even though you're a supervisor, we're people too. And so you don't want this employee coming back into the office, even if they're masking and following the NPIs. Can you keep them remote in order to minimize your contact with this employee? What else can you do? So we keep saying this and we'll say it again. Employee vaccination status is not a basis to allow continued remote working. So if that employee has job duties that requires them to be on site, their vaccination status should not play a role into whether they're coming on site or not coming on site. You are an employee, you need support as well. So reach out to contract tracing and vaccination navigation services if you have questions and concerns about vaccinations. If you are experiencing concern and you want to talk with someone, we have our employee assistance program that you can get free confidential counseling through. So don't hesitate to reach out if you need support. as a supervisor or as an employee. Okay, next slide. So now we have an employee that's concerned about the vaccination, that the vaccination will make them more likely to have asymptomatic disease. So they're not showing symptoms. They don't know that they're necessarily sick. And then they're more likely to pass it on to others, like their child that's not vaccinated. So how do you respond? Do you as a supervisor know enough about the available resources to support your employees with these kinds of concerns? What would you say to this employee? So the good news is no one is asking you to be a public health expert, thank goodness. In fact, we're asking you not to provide medical advice or medical information. So you can be empathetic, support that employee, connect them to the experts, which we've talked about where to reach out to. And then again, support them, but don't say, oh, you're wrong. This is this and this is that. Share the resources for them to get information. Some of this information is changing. So it is not up to you to clarify, it's up to you to refer. Okay, and then I'll pass it over to Jeff.
All right, so now we're going to shift gears to talk about policy compliance. So here, you and your team came back on site this week pursuant to your return to work plan, except for one employee. After repeated discussions and reviewing safety procedures, this employee refuses to return to work and get vaccinated or apply for an exception or deferral. So what do you do in this situation? Is this employee immediately terminated for insubordination? And you might be thinking, can you really do anything since this employee may still be working remotely, they're just refusing to come on site? Let me start by saying issues with compliance or non-compliance can be challenging and sensitive issues. So I really want to emphasize the importance of working in partnership with your HR point of contact to address them. In general, however, if an employee refuses to return on site and is not in compliance with the policy, we will follow the policy guidelines to initiate the non-compliance process, which first involves a series of notices to the employee, as Pamela described earlier. Ultimately, if on-site work is required and the employee refuses, it may result in corrective action. We obviously don't want to have to get to this point, so it's really important, especially prior to the implementation phase here, to make sure that we're discussing concerns with employees about returning and really educating them on safety measures being put into place to hopefully mitigate these issues as well as any potential impact to the unit. Now I'm going to send it back to Julie, who's going to take us through the next compliance scenario.
Okay, so you have an employee that will be working remotely. They don't need to be on site to perform their duties, but they do come on site for quarterly department meetings and the annual staff retreat. So since they work off site, do they need to comply with the policy? Are they considered 100% fully remote? And when you're looking at your dashboard, are they red? Do you need to follow up and get them to comply with the policy? What do you do as a supervisor? So what is 100% remote? So employees that do not come on site to UCI, so any UCI location that's controlled by UCI at any time, that's 100% remote. If they're coming on for once in a while department meetings, team meetings, trainings, any of that, then they're not 100% remote, they're partially remote. So that's a huge clarification. If you're gonna say that someone is fully remote or 100% remote, they should not be coming on site for any reason. If you're able to say that, then we need to have UC Path updated by your department so they can be flagged as 100% remote. The employee does not need to obtain vaccination or an exception. Employee also does not need to complete the daily symptom check or testing. By having UC Path updated with this flag, they would be removed from those programs. If in the future the status changes, so they were 100% remote and then now they are going to be coming on site, then we would need that flag updated in UC Path, and they would absolutely need to comply with all of these parts of the policy. So we expect very few to be 100% remote. Okay, let's see. Now I'm going to turn it over to myself. All right. So you arrive at work and you observe your employee not wearing a face covering. and they're required to do so. So what do you do? And what if this becomes an issue? What are you going to do? So, this is going to happen to a lot of us. Those in offices are going to shut the door, take face coverings off, work away, oh, I need that print job, jump out of their office, go to grab it. I forgot my mask. So the first is, okay, let's be respectful and civil. We don't need people, yelling, put your mask, we can be thoughtful and appreciative that this is a difficult time. People are getting used to a change. And so just remind the employee if this happens and you observe it. Yes, they need to comply and it's not okay, but we need to remind them, offer them a mask from the office supply, and then just remind them on what the face covers. If they're like, oh, I totally forgot, or if they're like, what are you talking about? Then you need to educate them on the executive directive on face coverings. Now, if this is a different scenario where it keeps happening, numerous occasions, they're working in an open area without their mask on, you've repeatedly reminded them, offered supplies, shared the executive directive, then this could be a pattern of noncompliance, which would be open for discipline. So we would treat it as a performance concern, just like an employee not following timekeeping or, other attendance, other kind of issues. So you would want to consult HR. And we would handle the daily symptom checking and also the asymptomatic testing if they're required to do so in the same manner. So if you notice this pattern of non-compliance, then you do need to reach out to HR to address. As UCI wants to address all of these issues fairly and consistently, you really need to reach out to your HR for guidance on how to respond. And now I will turn it over to Dale.
Thank you, Julie. So identifying vaccination status has clearly been an issue for much discussion amongst employees as well as in the larger community. In this scenario, one of your staff suggested that we all wear a special sticker to denote whether we are vaccinated or not. She thinks this is a great idea to put everyone at ease. And so the questions you might consider are, is that allowed? And is that considered sharing private healthcare information? Next slide, there we go. In general, UC will not be requiring employees to display or even discuss their vaccination status. The only exception to this is in UCI Health, where vaccination status is required to be displayed due to patient safety protocols. In this case, we should thank the employee for their thoughts, but politely notify them that that employees are not required to do this, and it would not be in support or aligned with UC's expectations for employees. You can remind the employee that vaccination status is, like other health-related information, private health information. As leaders, it is important that you do not ask employees to disclose their vaccination status or allow peers to ask others their vaccination status. If you hear this type of inquiry in the workplace, please ask the employee to refrain from such questions. However, this does not mean that employees cannot voluntarily reveal their vaccination status. Julie, we'll let you take the next scenario again.
Thanks, Dale. So you are all returning on site. You have your first team meeting back on site and you're talking about how great it is to see each other. And one of your employees says, hey, I know, raise your hand if you're vaccinated. You're the supervisor. You're the leader in this room. What do you do? Is it okay because you didn't say it? You're the supervisor, someone else did? Or is it not okay and you have to put a stop to it? If you're thinking through this and now everybody's raising their hand or not raising their hand and it's too late, what are you going to do? So what can and cannot be asked? So we know that we cannot ask about vaccination status, and employees should not be asking each other this either. No employee should feel obligated to share that information, even if it's said it's voluntary. So raising your hand, somehow showing that's not appropriate. And then just remind employees at no time should we be discussing each other's vaccination status. Supervisors will be aware of the cleared with MPI or not cleared status, but it's not appropriate for supervisors to be talking or sharing that status either. So just encourage your staff to show respect and civility. If they have concerns, encourage them to just treat everyone as unvaccinated, which means protect yourself, physical distancing, masking, and to just focus on what they can control and on themselves. Okay, I'm going to turn it over to Jeff for the next scenario.
All right, thanks, Julie. So now let's talk about vaccination verification. So in this scenario, you have two employees who are not following the process for vaccination verification. One employee is having issues uploading her documentation, so she says she'll just give you a copy. The other employee is refusing to upload the documentation because he's concerned that the system is not secure. So what do you do in this scenario? Is it okay to accept the documentation from the first employee? With respect to the second employee, do you try to assure them or tell them that the system is in fact secure? Or you might be thinking, do you ignore the non-compliance issues because of these issues that they've raised? Well, first, supervisors should not accept and or review medical records. As we discussed earlier, vaccination records are private health information. Really, the best thing to do here would be to refer the employees to contact tracing and vaccine navigation services. They're an incredible resource and they're ready and willing to help employees throughout this process. So let's just make sure we remind employees of this resource and encourage them to reach out. I do want to mention, though, it is important to understand that issues with system or privacy concerns are not valid reasons for non-compliance. Again, we want to help them by referring them to the appropriate resources to address these issues, but we really need to remind them of their obligation to ultimately be in compliance with the policy. Now, Dale will talk to us about meetings with visitors.
Great, thank you, Jeff. So as we return to on-site work, we'll be engaging in meetings with a variety of individuals. In this scenario, your unit is now having in-person meetings with both employees and outside individuals. One of your employees wants to require visitors to bring proof of vaccination status before meeting with them, or at least ask them. So the questions you might be asking yourself is, how do I respond to this? And can you ask visitors for vaccination status? The simple answer to this employee is that UC will not require visitors to disclose or document their vaccination status. Instead, remind the employee that UC is ensuring that everyone in the meeting is protected by ensuring that visitors are compliant with wearing face masks. The employee can also be reminded about safety precautions that he or she can take if they're uncomfortable not knowing the visitor's vaccination status. Group meeting coordinators should take the opportunity prior to the meeting to notify visitors of UCI's vaccination policy and confirm that they will comply with the expectations of either being vaccinated or masking. The group meeting coordinators should also request contact information of all the visitors and be prepared to provide that information for purposes of contact tracing should there be any exposure or COVID illness in the unit. Keeping guest contact information does not apply to large gatherings for events such as athletics or the arts. And now I'll turn it back to Julie.
Okay, so you overhear team members making disrespectful statements and judgments about their coworkers. There is an obvious divide among team members, with assumptions being made about vaccination status and then resulting judgments. So is there anything that you can do as a supervisor? I mean, do you just say staff are going to talk and that's their business? Or is there something you could do to ensure that there's an atmosphere of civility and that employees have respect for each other? So as a supervisor, it is your role and responsibility to ensure that you are creating this environment of support and civility among your team. You need to model collegial and respectful behavior in this context. You should not tolerate disrespect by other employees. Be aware that fear and judgment are often based on inadequate information. So encourage your employees to educate themselves if you're hearing, information that may not be accurate. And then encourage those employees to concentrate on their own actions and not that of others. If you are having a big divide and a lot of these kinds of issues come up in your team, whether it be about vaccination status or something else, maybe it's related to workload and work, you might have a bigger issue on your team. And as a supervisor, it's your responsibility to really dig in and address that. We are now in the middle of launching our engagement survey. So as a supervisor, you'll be getting results for that coming in October, November timeframe. So it's important that you think about these issues, you address them with your team, and you can utilize the engagement survey to help you with that if you notice there's a bigger theme of this going on with your team. Okay, with that, turn it back to Pamela.
Great, thank you so much to my HR colleagues. Hopefully some of those scenarios were ringing true for you and you got some helpful information, but we have more information yet again. So next slide, please. So the future of work resources for leaders. This website in the upper right is live now. We have a lot of information we add on a regular basis. And on the top left of the blue column, I know you might not be able to read all of the typeset there, but the very first item says return to on-site training for supervisors. That presentation is this one, and it's already on that website. So several people were asking, do I have access to it? Can I give a copy to somebody else? It's already live on the website. In addition, what you see here is a long list of articles, webinars, information for you as leaders to be able to handle this more complex environment. So make sure you bookmark this website. It is continually changing and being updated with current information. Also, we have a number of webinars happening right now. We've already had the first two, which are now available in recorded version. This is focused on handling employee anxiety and just going through such a major transition. All of these topics are very relevant for what we're all going through right now. And as you can see, we have not only some great speakers from UCI, but also some hosts that are leaders of our cabinet and senior leadership. So you get exposed to them. So these webinars are every other Tuesday at 11. So we encourage you to attend some of those, and the recordings and the slide presentations are also available on the website. Okay, so we do have a little bit of time for some questions. We actually have already answered about 50 of them online, but there were a few questions regarding asymptomatic testing. And I will tell you that we are working on that. The process for that is being planned. So we don't have a lot of details on that just yet. I do know that the testing results will be part of the compliance dashboard. So not only will senior leaders in HR have access to an employee's status, if they're yellow, meaning they have an exception approved and therefore they need to have the weekly asymptomatic testing, that will be indicated on the dashboard. So there will be a process to do that. And there was a question about whether student employee compliance status will be on the dashboard. And the answer is yes, we do have a tab on the dashboard for student compliance. It's independent of our numbers for employees from a compliance standpoint, because it is a separate process. But from a convenience standpoint, we did add that tab onto the dashboard. So you'll have access to student employee compliance. Okay, let me take a look at some of these questions. There's one here. For clarification, we should not offer our staff unvaccinated stickers or pins, even if they wear them voluntarily. Julie, do you want to take that one?
Sure. So in general, we don't want to put out a basket of I'm vaccinated, just like the I'm voted kind of stickers. We know that people are doing that and they think it's helpful, but even if it's voluntary, it's creating an environment for employees to feel pressured to do that. And so we really don't want to encourage departments to do that. If there's one out, if it's already happened, you know, in the example of raise your hand, once things like that happen, it happens. And so you just got to address it, say, let's not do this. This is why we're not going to do this, and move on. So if someone puts out a basket, just remove it and move on. It's not technically a non-compliance of a policy. It's just not a good idea.
Thank you, Julie. We've got a question from someone about employees. They're asking if they were vaccinated through UCI Health, do they still need to upload proof of vaccination? What you can do is you can log on to the website where you do upload documentation, and it will show you if you have a record already, and you can actually print your vaccination record out. So you can not only check, you can check if your record's there. If not, you can upload it, or you can actually print your record through the website. So maybe Julie, if you could put in the chat, the upload website, that would be great.
I'll do that.
Lou,
I also wanted to clarify on the dashboards that managers will have access to. You will not see the results that your employee has on their testing. You will only see the date that they got tested. So I just want to clarify that point. And I'll post that other link for the exception process.
Thank you, Julie. We have a question. Can I voluntarily enroll in asymptomatic testing if I'm fully vaccinated? The answer is yes, we will have that option available. Again, I'm sorry, that's the asymptomatic testing is still, a couple weeks out. So we'll have a lot more answers on that going forward. Checking a couple of things. Will there be a checklist for student workers returning to work, or the same rules will apply as other staff employees? Yes, student workers are that while they have to upload their vaccination documentation via the student portal, they have to follow as a worker all of our requirements for NPI and status. Okay, there's a question about whether a medical exception can be denied. Any of my co-workers my HR colleagues want to answer that one?
Sure. Yes, and a medical exemption, we're calling everything exception, but technically it's a medical exemption. It could potentially be denied if the reasoning isn't meet the standards that UC is reviewing against. It is a team of professionals that's reviewing that, and the employee would be contacted. So.
And just to add on to that, to the extent that a medical exemption is denied, there will be a notice generated, and the employee will be given 14 days from that period to either provide proof of their first shot or request an exception.
Additionally, if the form is incomplete, remember that could also be a reason for denial.
Okay, we do have a question about physical distancing while at lunch. What's the rule? Physical distancing while at lunch.
Well, I'll take that. My understanding is that physical distancing is still required because we are under a mask mandate. And once you remove that mask to begin eating, then you are to be physically distanced.
Thank you, Dale. We have a question about how do we get access to the dashboards. Talk to your local HR person because depending on your unit or your school, that might be handled centrally or it might be handled through supervisors. So my suggestion would be to go ahead and ask local HR on that. Another question about dashboards, what level of manager supervisor will have access to the dashboard? Again, that's really based upon how your unit is handling the process. There's a question about are employees required to wear masks when alone in their offices? Julie, any insights there?
Yeah, I just submitted the answer to that one.
Oh, okay.
So you do not need to wear, if you can control who is accessing your area and you're able to close it with a barrier such as a door, then you don't need to wear a mask. But as soon as you leave the office, or if you work with an open door policy and your door is open, you do need a mask. And so I've included, when I answered that question, which I think it goes out to everyone, the link to the executive directive on face coverings, which has that.
Thank you, Julie. Lots more questions we're just reviewing here. How will managers know that an employee and a student employee who have been approved and is complying with weekly asymptomatic testing? Will all supervisors at all levels get access to the dashboard, and is weekly asymptomatic testing beneficially approved? Okay, so there's a lot of questions there. First, if someone has an approved exception to the vaccine policy, they will be yellow on the dashboard, and they will be required to be masked and do the weekly asymptomatic testing. And then a record of that testing will appear on the dashboard. So again, that will be available for review. And as I mentioned, not all levels of supervisor may have access to the dashboard. It really just depends on how your school wants to handle it. And then the weekly asymptomatic testing, that has been approved. It's just from a process and planning standpoint, more details are being worked out. It's probably going to take another week or two. All right, let's see, going back to the first topic about employees' fear of being exposed. What if the department recently had a notice of exposure and the employee that tested positive shared her results with a few of her colleagues? Many employees are now fearful of coming into the office and want to use this experience without not wanting to come into the office. What can we do? Julie, can I have you handle that one?
Sure. Can you just restate it? Or,
yep, sure. It's a long question. What if the department had a notice of exposure and the employee actually shared that she was the one that had COVID? Many employees are fearful of coming into the office and they want to use that experience with not wanting to come into the office. What can we do?
Well, first of all, that employee and supervisor would be working with either occupational health or COEH on when it's safe for that employee to return on site. If employees are just using the fact that we had a positive case in the work site and we're all on site, I don't want to come because see, that person was positive. So the first is if they're concerned about the employee coming back and they're still there, well, they're working to make sure that employee doesn't come back until it's safe to do so. Second is it's just overall, see, this could happen. In a lot of these scenarios, I see some other questions about this as well. You can provide the information from that Q&A that went out in yesterday's UCI Digest, which was excellent. You can encourage your employees to go to the UCI Health Affairs Town Hall tomorrow that has COVID updates to get educated information or information from our experts. And at the end of the day, this is going to be tough for all of us. We're all employees. We all have some level of comfort with this. And so just understanding, I understand your concerns. I know this is a really tough time. We need to partner and work through this. And so this part of your job does require you to be on site, and I need you on site for that. So how can we make it more comfortable for you? You know, oh, well, they sit right next to me. Okay, could you move do you have room to space people out? Would that make people more comfortable? Oh, I have my people come and sit right next to me in my office across my desk. Can you move the chair over by the door where it's farther away? So kind of work with the employee of like, we can't change this, which is you coming on site, but what can we change to make you more comfortable? I think that's the general takeaway with these issues, because it all comes down to, we're still in a pandemic. We're still nervous about this. We have the information, our leadership has the information from the experts. They're confident in our plan and moving forward. We have the appropriate protections in place. So employees need to be aware of all that. And then they also just need to feel supported.
Thank you so much, Julie. Very helpful. We have someone saying that an employee sent them their proof of submission. Is this a health record and should it be deleted?
Yeah, I can take that. Again, you know, anything related to proof of vaccination, you know, anything remotely related to that, we don't want to be accepting those as a supervisor. Again, the best thing to do would be to refer them to contact tracing and vaccine navigation services.
Great, thanks, Jeff. Similar question about how do we handle exposures and outbreaks. We have an entire organization set up for that. The COEH and Contact Tracing and Vaccination Navigation Services have been handling that for 18 months. So we have a fully operational group handling all of those. We have time for just a couple more questions. How will we proceed if an employee is only partially vaccinated as of September 1st? How will we proceed if an employee is only partially vaccinated as of the effective date? Jeff, do you want to handle that one?
Sure, yeah. So I guess there's a couple of points there. So, they would show as yellow on the dashboard, is my understanding. They would be required to comply with all of our non-pharmaceutical intervention requirements. And the guidelines do allow for a 8-week period for them to provide proof of full vaccination, right? So ultimately they will, if they're partially vaccinated, maybe they've only received the first shot, they will have to provide proof of full vaccination, but they will be in the yellow status, as I understand it, will be allowed on site subject to the NPI requirements.
Thanks, Jeff. On a similar topic of kind of timing, if a staff member is not compliant by the deadline, how soon will they receive a notice of non-compliance?
Yeah, great question. And so the guidelines walk through a series of notices that will go to employees, and there's specific timeframes associated with each notice. Those notices won't start until the implementation date. And the timing between the notices does vary. For example, between the first notice and the second notice, it's 3 business days. Between the second notice and the notice of continued noncompliance, it's 14 calendar days. So there is a specific process that's outlined in the guidelines in terms of how those notices will pick out.
Great, thanks, Jeff. We had a question, as I've been referring to local HR, what does that mean? Basically means who your human resources person for your unit is. We have on the health side and med center, HR is centralized, so you have a central HR person, but on the campus, we have school, campus personnel officers and so on. So whoever is your human resources person for your particular division. All right, there's a question about masks being supplied every day. Will and how work areas will be sanitized every day? That's really a question for EH&S. I do know that we have, safety protocols in place and masks are available. So EH&S would be a great resource for that. Question is, if vaccine exemption is denied, will there be an opportunity to resubmit with additional materials for consideration? Any of my panelists know the answer to that one?
Yeah, I'm happy to take that. So if a request is denied, there's still the option or the ability to submit a new request, right? So that might provide the additional information that maybe was missing from the initial request. But if a request is denied, it will start that period in terms of notification and the timeline to be in compliance. So just be aware of that.
Great, thanks very much. Okay, we are coming up on the hour and we have more questions than we have time to answer. Someone did mention that is there a possibility to summarize the questions that came up, because sometimes even reading through the answers as you're a member, an attendee is difficult. But we will definitely try to thematize and summarize all of the questions that have come here today and make sure that we add them to an FAQ section of the resource website for leaders. So with that, I really just want to thank my colleagues, Julie, Jeff, and Dale, for helping out and sharing common scenarios. I'm sorry we didn't get to all of your questions, but we answered quite a few. And I hope that you found this webinar helpful and that you can listen to it. We'll have the recording up on the website probably sometime tomorrow. So thanks everybody for joining and have a great day.